Hello, everybody, and welcome to our capstone presentation. My name is Jordan Brown, and I precepted at Evergreen Treatment Services, which is a mental health facility in South Seattle.
Hi, I'm Carlie Kilcup, and my preceptorship location was at Mary Bridge Children's Hospital on a pediatric med-surg floor. The title of our project is Effective Nursing Care for the Adolescent with Depression Post-Suicide Attempt. Throughout this presentation, you can see us in the video right now, but I'm going to minimize us and put us to the side so you are able to see the entirety of our poster, and then at the end, I'll bring the video back. But now Jordan is going to talk about what prompted our interest in this topic.
So Carlie and I have both demonstrated an interest in mental health throughout the nursing program, and it's been a goal of ours to have create a project regarding this specialty. Something else that prompted our interest was just how prevalent of an issue this is. So some studies have shown that of all the adolescents that need mental health treatment, only about 20% of them are actually receiving treatment. So we hope that through our project, we can shed some light on this unique population. Another reason that we wanted to craft a project based on this population is what stood out to us in our preceptorship facilities. So at my facility, whenever a patient with depression and suicidal ideation would come in, there was a lot of confusion over, best assessment practices and how to best care for the patient. And so we hoped to dive in a little bit to try to find what is the best way to care for these individuals. And Carlie also has some experiences at Mary Bridge regarding this.
Yeah, while I was at Mary Bridge, even if I wasn't necessarily directly working with a patient who was in there for suicidal ideation, we had at least one adolescent on the floor at all times who was in their post-suicide attempt. And with these patients, the nurses had to fill out certain safety checklists between every patient and every shift. And the thing that was most confusing for the nurses was I don't think they were exactly properly trained on when to turn in the checklist, if it was every shift, if you turn it into the charge nurse every 24 hours. And so there was just confusion around those checklists. They were there and they did help with the safety of the patient, but I felt like there could have been a little bit more clarity within the nurses on how to effectively use those checklists and what timing was proper for turning those in and who to turn those into.
Absolutely. So now we're going to talk about, what surprised us about this process. So one thing that surprised Carlie and I was that there was no huge consensus on the etiology of depression. There's some theories that are more accepted than others, but again, there's no huge consensus. Some focus primarily on neurotransmitter dysregulation, primarily regarding serotonin, and others focus on an altered hippocampus and prefrontal cortex cell structure. So this ambiguity made it really interesting for Carlie and I to delve deeper, into the pathophysiology of these conditions. And something else that surprised us was just the different treatment modalities that are offered for this patient population. One that we thought was really interesting is phototherapy, and this is primarily used for seasonal affective disorder. And that is about, putting white light essentially directly to your face for about 30 minutes. And that can help kind of treat depression. And then another modality that we thought was, or another intervention rather, that we thought was interesting is electroconvulsive therapy. And that's utilized also for depression, usually if other interventions haven't been effective. So there are lots of surprising aspects of this project, but those were a couple that we wanted to highlight. And now Carlie is going to talk about takeaways.
Yeah, so we had a few main takeaways that we would want people to come away with after looking at our poster. The first one is that each patient is very different from the last, even if their suicidal attempts were similar. When treating these patients, the nurses do focus on the Tylenol overdoses or whatever mechanism they use to attempt the suicide. But if the underlying problem is not addressed, the problem is not just going to go away. Each patient has something different that pushed them to the point of suicide attempt, meaning that their treatment may need to differ from the other patient who you saw who is very similar to this patient. Without some form of therapy, counseling, or another form of treatment, these patients will not be back to full health mentally. The next takeaway is that when assessing these patients, you have to remember that they're more complex than your typical med-surg patient, because they do have things you need to assess physically, but then there is the mental side that the nurses really need to pay attention to. And lastly is that even if a patient didn't come in necessarily for any mental health issues, it's still important to check in with every patient that you see on the floor to make sure that their mental health is in a good space. And so the last thing that I want to say is that the things that were really reinforced when we were doing all of our research throughout this project is that holistic care is so very important when dealing with any patient population, especially adolescents with depression. But in general, taking care of patients holistically is going to make the difference with how they turn out in the end. And that concludes our presentation for our poster. So I'm going to bring us back in the video. And so we're just going to give some acknowledgments, and I'll start. I really want to thank my preceptor at Mary Bridge, Sarah Kelly. She graduated from PLU not too long ago, and she was seriously the best preceptor I could have asked for.
And I would also like to thank my preceptor, Rhonda Wade, for her commitment to my development as a nurse, and the time that she spent with me. We would also like to thank Dr. Zeichkin and Dr. Morrison for their feedback and dedication to helping us on this project. And we're so thankful. This project wouldn't have been possible without them. And we would also like to acknowledge the members of our cohort. We are so thankful for them. Their passion for nursing was just so inspiring to us, and also helped us create this poster. So this concludes our capstone presentation. If you have any questions, please don't hesitate to email us or post a comment down below. Thank you very, very much for listening.
Thank you.